You would have seen this in the link of your chat box, but also if you could kindly just register for today's webinar, that'll be great, so we can keep track to make sure that we share all the resources that we have today on the webinar. I'll be sure to put it in the chat link coming up next. Apologies, there should be one more screen here.
Back.
Yep, it's, thank you. So just a few housekeeping matters before we begin. I should start by introducing myself. My name is Amy George. I'm with Save the Children Asia Regional Office. And we welcome you again to today's webinar on Safe Back to Schools. Firstly, if everyone can make sure to please mute your microphones and turn off your video, that'll help with all the bandwidth issues. I'm sure you all are very familiar with webinar procedures by now, but just to make brief mention of that. I, along with the other facilitators, will be watching the chat box, so feel free to post questions anytime and stay active and engaging as questions come up, and we'll be sure to collate them for the Q&A at the end as well. You might also be familiar with the raise hand feature. That's just a good way if you'd like to share something immediately or clarify anything, feel free to use that, and we'll try as best as possible to give everyone a chance to share their insights. And if you're having any trouble at any time, feel free to reach out to Rochelle or myself. We're monitoring on various devices to try to problem solve and troubleshoot as we go along. Once again, registration will help us, and I'll be sure to share that in the chat box. So again, we thank you for all the various affiliations who've supported to make this possible. And I'll hand over to Rochelle, who is our humanitarian technical advisor on education with the Save the Children office. Thank you.
Good afternoon, everyone. Thank you for making time for this webinar, and we're very pleased to have all of you today. It's very good to see different organizations represented in this regional webinar. So this is the launch of the interagency resource, Safe Back to School, a Practitioner's Guide here in East and Southeast Asia. And this is actually the second of the 2 webinars that we have planned. We had one yesterday for South Asia. And for the next 90 minutes or so, you will hear about what this resource is all about and its key elements, and hopefully spark some inspiration on how this can help you in supporting schools and school communities to ensure the safe reopening of schools in this global pandemic. The COVID-19 pandemic has resulted to disruption of children's education, not only in our region, but worldwide. However, we also know that education is a key strategy to help the world recover from the impacts of this crisis. Safety of learners in schools and learning facilities, as well as learning inequalities and protection concerns must be addressed when schools reopen, thus this resource. Before we begin, I'd like to acknowledge the organizations that have come together to plan for this event. We have ASBE, the Asia South Pacific Association for Basic and Adult Education, Plan International, Save the Children, World Vision, UNICEF, and the Norwegian Refugee Council, in coordination with UNESCO and the Asia Pacific Coalition on School Safety, or APCSS. And apart from the resource speakers who will be introduced later, I'm joined by other colleagues to co-facilitate this event. You've met Amy George from Save the Children International, Nia Trin of Plan International, and Cecilia Soriano of ASBE. And now to welcome us all and kick off the webinar, let's all listen to a few words of inspiration from Marla Petal, Principal Advisor for Urban Resilience and School Safety, Save the Children Australia, on behalf of the Asia Pacific Coalition of School Safety, or APCSS, and the Global Alliance on Disaster Risk Reduction and Resilience in Education Sector, or GADRES. Let me just try to say to share my screen and for the video.
Rochelle, if you could kindly just check with the audio. It's not quite coming through.
All right.
I think
Maybe.
when you share the screen, there is an option at the bottom on the left to share with sound. So if you reshare again and click that box, we'll be able to hear.
Okay, maybe just so we won't get delayed further, we'll sort it out and then we can move on to our next speaker, if that's okay. Or is this Nia?
That works well, Rochelle. I can continue with the presentation.
Hello, this is Marla Peddle with Save the Children. I'm here to welcome you on behalf of the Asia Pacific Coalition for School Safety and the Global Alliance for Disaster Risk Reduction and Resilience in the Education Sector to this important webinar on safe back to schools with the COVID-19 pandemic. We are all terribly concerned about the health impacts of this pandemic, about the impacts on hunger, homelessness, livelihoods, on all of the Sustainable Development Goals. And we are particularly concerned about the potential for growing inequities in education. But I also want to say that we have much to be grateful for and much to get together on and to learn. We've been at work on child rights for comprehensive school safety for more than a couple of decades, trying to make sure that children are safe and protected in schools, that their educational continuity is safeguarded, that education sector investments are safeguarded, and building a culture of safety. But we have not until this moment had every parent, teacher, and many children involved in the conversation. And now they are all at work on the solutions. Educational continuity and the need for it is no longer something that we have to argue for. I think it's also important that we are discovering the importance of the relationships between teachers and children and parents and children, and how core that is to their learning. And I have no doubt that we will learn a great deal that will have a lasting impact for us in terms of educational reform and educational transformation. But we also have many, many unanswered questions. There is a great deal of research to be done on the impacts of this pandemic on education in the long term. And some things we need to do quite quickly. We need to capture perishable data so that it can be looked at later. We need to capture the voices of children and parents and teachers. And we also need to understand better how to classify and how to understand all of the adaptations that are being implemented for educational continuity right now. So I hope that you'll be part of this process and that you'll stay in touch with us. You can go to the GADRIS website and you can join the Safe Children, Safe Schools Global Community of Practice. If you're interested in research, please drop us a line. We have a new working group on COVID-19 public health and social science research on children, youth, and schools. And we look forward to working with you together in the long term. Over to you for the webinar.
Thank you, Marla. And I'm glad that worked out well. Thank you. We now move to the next part of this webinar, and we have two speakers to provide us with some regional context, focusing on the impact of COVID-19 in the education sector and the status of school closures and school reopening in our region. They will also touch on some of the key resources that have been developed during this pandemic and talk through how they're linked with the resource that we are launching now, which is the Safe Back to School Practitioner's Guide. Everyone, I'd like to introduce you to our speakers, Ms. Janelle Bab and Ms. Maida Pasik. Ms. Maida is the UNICEF Regional Education Specialist for East Asia and Pacific, responsible for providing strategic technical guidance to country office on second decade adolescence education, gender, and education in emergencies. Since February of this year, she has been responsible for coordinating the regional response to COVID-19 within UNICEF. And prior to joining IPRO, she was the Chief of Education and Adolescent Section in UNICEF, State of Palestine, and also served as the Cluster Coordinator and Co-Chair of the EIE Working Group. Ms. Janelle Bab, on the other hand, is the UNESCO Regional Advisor on Education for Health and Well-Being for the Asia-Pacific region. She is based in UNESCO's Regional Bureau for Education in Bangkok, and she's been working in the areas of HIV prevention education, comprehensive sexuality education, school health, and young people's health and development for over 15 years, including in the section of health and education at UNESCO headquarters, Paris, the UNESCO Office for the Caribbean, and the Ministry of Education and Jamaica. In her role right now as the regional advisor, she leads the implementation of UNESCO's strategy on education for health and well-being in Asia Pacific to support ministries of education and their partners to deliver good quality education in safe, inclusive learning environments that contribute to healthy lifestyles and gender equality. She's also presently the COVID-19 education response focal point within UNESCO's Regional Bureau for Education. So Janelle and Maida, over to you, please.
Thank you, Rochelle. Thank you for the lovely pleasant introduction. And first of all, thank you to all of the organizing partners for assembling, putting together this very timely and relevant webinar and inviting UNESCO to be a part. I'd like to acknowledge as well my co-presenter, Maida, who's sharing this space with me. And of course, welcome, and I'm happy and looking forward to interacting with the colleagues on the call and to learn from the experiences of school reopening happening in the region. Thank you. The presentation is up, I can see, great, excellent. I'd like to just preface my couple of slides with the acknowledgement that most of what I'll be presenting, if not all of it really, will not be new to colleagues on the call. So it's really offered up as a reminder and really as a backdrop to the substantive discussion around the practitioner's guide, and especially the learning exchange between countries on school reopening and that experience. Next slide. So when we think about the impact of COVID-19 on education, we perhaps think first about the school closures that were instigated as a public health measure to mitigate the spread of infection. And really, UNESCO started monitoring school closures from as early as February, and at its peak, sometime around early April, school closures were in place across the world in more than 190 countries, and impacting more than 90% of all enrolled learners worldwide, representing more than 1.5 billion learners. A more recent snapshot here, as you can see from this infographic, dated July 23rd, shows a reduction in those numbers, but still quite substantive. We're presently in 107 countries worldwide, school closures are still in place, representing more than 60% of all enrolled learners. Next slide. And if we zoom into the East and Southeast Asia region, where we have now, there are 16 countries here, and these 16, presented by UNESCO Institute for Statistics, covers the 10 ASEAN countries, Timor-Leste, and 5 countries of East Asia. And roughly half of the education systems of these 2 sub-regions are still closed, and the other half either in a stage of reopening, partially reopening, but mostly reopened. So we're still talking about at least 61% of all learners from early childhood up to tertiary levels of education who are still not engaging in face-to-face learning. Next slide. So this slide and the next slide really is just another way of representing the data. And I just want to acknowledge that, the situation of data around school closures and reopening especially is really in a state of flux. So So forgive me already if some of what you see here may not represent what you know as a current status in your own countries, because the mapping summaries don't often keep pace with the data, especially in a situation where today all schools may be reopened, but there might be a localized spike of infections and there are some partial reclosures for an interim period. So we can see here again the spread of the countries in the two regions of concern, looking at predominantly, well, at least half and half, schools that are partially or fully reopened and those that are closed. And schools that are reopening, of course, have been planning that in a very gradual and phased basis, but of course acknowledging, as we all are, and as we get to the practitioner's guidelines, what it means to plan for reopening, and recognizing that reopening is not a static point, but can involve moving back and forth between closure and reopening. Next slide. Again, just another way of looking at some of the data. All of the countries are not represented, my apologies, but we can see, you know, that really the status of school reopening is actually following, or meaning to follow, the state of the epidemic at country level. So ministries of education are really being called upon not only to know the epidemic, but really to take heed of and be linked to the broader public health operations around managing the spread of the infection. So you will see that the staggered basis by which some countries reopen quite early and some only now very recently starting to reopen, and of course many still closed, and some without dates for when reopening will happen foreseeably. Next slide. So this summary graph by the World Bank sort of brings together then the actual and potential impacts of COVID-19 on education, on the system of education, how it's structured, how it functions, but especially on the people that the education system is serving, teachers, learners, and their families. And the impacts, of course, are structured into the short and medium as well as the longer term, and are both direct and indirect in nature. In terms of some of the shorter term impacts of school closures, we're talking very concretely about loss of learning, around delayed examinations, reduced access as well to essential school-based and social and protective services. And then also recognizing that where mitigation measures are put in place to support continued learning, such as through remote learning strategies, through broadcasts, through online opportunities, that not all learners are able to take advantage of those opportunities. And this is really because of pre-existing inequalities in education that are really being exacerbated by the pandemic. And home learning may itself be a source of stress for families and learners, with parents being called upon to take on new responsibilities, sometimes with limited time or resources of their own. Parents and caregivers who don't have the same level of education or literacy, or speak the same language of instruction of their children, or even parents with children with special educational needs face compounded challenges in ensuring their children's continued learning and mitigating that learning loss. In addition to educational impacts, past experiences tell us that there are also heightened health and well-being impacts on learners, including around reproductive health, and especially impacting disadvantaged and girls. And with more and more families under financial stress and many falling into poverty, rates of early and forced marriage and early and unintended pregnancy can increase. And there are also increased incidents of unplanned or forced sexual activity among adolescents and young people, which can present risks of contracting STIs, including HIV. For children who do have online access and who may be spending a large amount of unsupervised time online, the risks, of course, include vulnerability to cyberbullying and sexual grooming. And unfortunately, one of the most tangible outcomes of COVID-19 is this ever-increasing socioeconomic gap between learners, with some of the most vulnerable learners bearing the greatest impacts. And as we project forward then to these longer-term impacts on education, we can see that these include the increased risk of dropouts of these vulnerable and marginalized learners, reductions in household poverty that can contribute to child labor. We see the risk of reduced financing perhaps to the education system as those finances are prioritized elsewhere, which of course has those longer term impacts on not only access to but quality of education, undermining and reversing some of the goals and progress made by countries towards SDG 4. Next slide. And Maida is going to talk a little bit more about the considerations for a school reopening. But really, as schools gradually reopen, ministries of education are called not to a small task, to consider back-to-school strategies that ensure the readiness of the system for a school reopening, for learning continuity, for broader system resilience that anticipates as well as reduces the risks of the infection and deals with possible resurgence. And quite a few resources have already been produced, but we'll zoom into just a couple today. They're both technical and operational in nature, but they do provide support to the education system and their partners in planning and implementing and monitoring school opening. At this point, I turn over to Maida, and I'm happy to take any questions at the end of the session. Thank you.
Thank you, Janelle. Can everybody hear me?
Loud and clear.
Oh, fantastic. So good morning, everybody, also from UNICEF regional office side. Very happy to be here and co-present with our UNESCO colleagues and also participate in the discussion later on. So I will just take us quickly back to the beginning of the crisis and just give us a quick overview of how UNICEF, UNESCO and other development partners actually work to respond to the challenges that Janelle has just outlined. So in the early stages of the pandemic, a lot of work has been done on risk communication. So this was kind of a first task to really make children, teachers, communities, parents aware of the risk that COVID was posing to their health and well-being, and also give them some guidance on how they can protect themselves and how they can protect the school environment in which they were still operating in those early stages. So a lot of work, and you see some of the products that we have developed. Communication products were channeled through schools, through social media, in the communities, alongside some of the supplies in the poorer communities, mostly health and hygiene kits, etc. We have then further developed the Safe School Operation Guidance that kind of articulated a little bit better to schools and parents and communities how the schools can continue to operate safely. And then we also supported governments in the contingency planning and emergency planning and coordination. And this was done as part of our work as a cluster, as a co-cluster lead with Save the Children and other partners. And perhaps the most challenging, but in a way also exciting area of our work and response was the supporting governments in the provision of continuity of learning, be it as an online learning provision that many countries have put in place once the schools close, or through TV, radio, and other alternatives. So this is kind of the introduction. This is the early phase. However, as the epidemiological situation improved, in particularly in East Asia and the Pacific region, governments started looking into possibilities to reopen schools and turned to development partners for some advice and guidance on decision making in this area. Next slide. So for us, as Janelle has mentioned, some of the underpinning principles for making an argument of why schools should reopen came from the realization that the longer marginalized children are out of school, the less likely they're to return. Of course, there's also the significant protection and mental health and psychosocial risk that they're facing. As well as this disruption of essential services such as nutrition, clean water, etc. And of course, for us educationalists, the most important that there are significant learning losses the longer schools stay closed. However, these principles were kind of laid out to the government for their decision making, understanding, of course, that the ultimate decision will depend on the broader set of conditions, including health and socioeconomic considerations. Next. So, you can see it. So in sometime in April, a group of 5 agencies, UNESCO, UNICEF, World Bank, WFP, and UNHCR, and I should say with the support of WHO, put together a framework for reopening of schools to inform the decision-making of governments on why, when, and how to reopen schools, and also to guide their implementation process. Again, understanding that this decision is going to be linked to the broader public health and economic considerations. Next slide. So what does the framework do? The framework, I'm sure most of you have seen it already, lays out these 6 areas or 6 dimensions that governments should look into in their planning process, and suggests specific policy programs and interventions under each of these areas that should form the part of that planning. So for example, the first area, safe operations, deals with the policies and programs, interventions that governments should put in place to ensure that schools can operate safely. So the checklist for reopening schools, protocols for behavior in the schools, etc. The second element links to learning and to ensure that the lost learning is recuperated and the learning can continue. So here, some policies and programs suggested would be remedial learning, blended learning options, revision of school calendars and curriculum, etc. The third area suggested for further planning, short-term and longer-term planning, is related to including the most marginalized, again, recognizing that a lot of children have not been accessing online learning options even before the crisis. We're not accessing schools, so ensuring that that when schools reopen, as we say, they open with a wider door, meaning receive more children than before. And then the fourth area deals with well-being and protection, and looking into strengthening those services that children rely upon for their health and well-being. Cutting across these 4 areas of planning are obviously policies that governments need to improve or enact, and of course financing that needs to support these the plans. Next slide. So what the framework does is lays out a timeline for critical actions prior to reopening, actions that are related to the reopening process and the long-term planning. So as you can see here on the screen, it recognizes there are some immediate policies and programs the government have to put in place around safe school operations and learning, etc. And then there are some longer-term changes and policies that need to happen to ensure that the schools continue to kind of gain resilience and improve the quality of the education that they deliver. In a way, what framework does is really attempts to guide governments to capitalize on the opportunities that the crisis have provided to improve the system, improve the delivery, even including through alternative provision, and strengthen overall resilience of the system. Now, some governments in the region, and I can give you an example of one, Vietnam, have used the framework to really inform their short-term and long-term programming and preparation for school reopening. So for example, immediately after the framework was developed, government of Vietnam, Ministry of Vietnam has identified specific policies that they felt that they were lacking, that they needed to put in place in order to ensure the system is strengthened and resilient to any further or any future COVID or any other kinds of pandemics. So, for example, they are developing policy on distance learning, etc. Also, you may have seen the framework and seen that it's actually only 4 pages long, if that. So to accompany the framework, development partners, including UNICEF and UNESCO, and others have started developing supplementary guidance to implementing the framework and supporting the planning. And one of the key documents or guidance in that sense is going to present it to you today. So without further ado, I'll stop here and turn it to my colleagues in Save the Children to present back to school guidance. Thank you.
Nia? Nia, I think you might be on mute.
Hello, can you all hear me?
Yes, now we can hear you. Go ahead, please.
So thank you very much, Janelle and Maida, for sharing the regional context for schools closures and reopening of schools in East and Southeast Asia just now. As you're all aware, a lesson learned from the COVID-19 schools closures must inform disaster and emergency preparedness for future outbreaks of school COVID-19 alongside with other contextually specific hazards that might further jeopardize children's, especially girls and boys, rights to learn, be safe, and survive. So as we are now approaching to the new stage that some governments, I mean the governments in our regions are preparing to reopen schools and the other learning sites, ministries and school committees must minimize the risk of transmissions of COVID-19 within learning spaces and address the learning inequalities, as well as protections concerns that exacerbated by COVID-19 schools closures. So we are wishing through this webinar to introduce this Safe Back to Schools, a practitioner's guide to everyone, especially to many stakeholders across our regions, to share with you the overview of what the resources, inter-agencies resources is about, and also the different parts of the guide. Within that aim, we are introducing to you now 4 experts who have been closely working on on the development of this guide. Firstly, I would want to introduce Rachel Famin, Humanitarian Technical Advisor for Education from Save the Children International Asia Regional Office, who will be sharing with us the information on the checklist of the monitoring, evaluation, and accountability and learning of the document. Then the health and nutrition and wash sections of the document will be introduced to you by Rosianto Hamid, Humanitarian Technical Advisor for WASH from Save the Children International Asia Regional Office. Following with that, David Bloomer, our colleagues from Save the Children International Asia Regional Office, Humanitarian Technical Advisor for Child Protections, will be sharing with you all the information in the guide on mental health and psychological support and the child protections. And lastly, Dian Umwa Mahoro, Early Childhood Care Program Coordinators from Save the Children International Rwanda, will be also share with us the information from the guide on early childhood development within the context of school reopenings. So over to you now, Rachel, for your sharing.
Thanks, Nia. Can we please show the next slide? All right, so those are actually the names of our presenters today. Thank you for the introduction, Nia. Move to the next slide, please. Okay, so the Safe Back to School Guide aims to be a user-friendly, practitioner-focused tool that outlines the key steps needed for a coordinated, inclusive, all-hazards approach to school reopening, and there are links to further guidance whenever this is appropriate. It's currently available in English, French, and Spanish, and there's also currently it's also being currently translated into other languages such as Arabic, Portuguese, Italian, and Turkish. So why did we do this guide? Now, we recognize that there are several other resources that have been developed to support school reopening in this pandemic, and our colleagues from UNESCO and UNICEF have mentioned and detailed some of them. The Safe Back to School Guide helps concretize the UN framework to reopening schools into actions that can be taken on the ground. And this guide was written in a practitioner-friendly way, suggesting specific activities across the sectors of education, protection, WASH, and health and nutrition. It also complements the UNESCO Supporting Teachers in Back-to-School Efforts, a toolkit for school leaders. That's another resource there. So the Safe Back to School Practitioner's Guide is something that program and coordination teams can pick up and run with, but also great for collaboration and coordination with ministries and local authorities. And we refer to this resource as interagency because technical experts from multiple sectors and many agencies have contributed to the writing and review of this guide. And the organizations that have been involved in planning for this event are some of them. And it is endorsed by both the Global Education Cluster and the the Child Protection Area of Responsibility. Having the endorsement of these two sectors further emphasize the importance of integration for COVID-19 response. Next slide, please. The Safe Back to School Guide provides unique opportunities for integration and technical quality and to build back better. Now, why do we say integration? Because right now it is a shared priority across programs, operations, and even advocacy. And COVID-19 has highlighted how truly interconnected all our sectors are. So this is an opportunity to work more efficiently and towards more impact for children if we work together. On technical quality, this guide has been written drawing upon our best practices and our experiences in our work in safe schools and parenting without violence and mental health psychosocial support, and as well as previous examples and responses, previous responses like the Ebola crisis. And we build on the experience and evidence so that we can make the COVID-19 back to school experience much smoother and safer for children. And finally, this is an opportunity to build back better. Because COVID-19 surprised us. This is a chance to get the foundations right for the next emergency. And in this region, there's always another emergency, be it a health pandemic or another hazard like a cyclone or an outbreak of conflict. Next slide, please. So the Back to School Practitioner's Guide have all these parts. We have the checklists. There are two kinds of checklists. The first is the integrated safe back to school checklist for program staff. And this is especially useful for the project design and coordinated intersectoral planning, such as the humanitarian response plan, and for monitoring and oversight. Now, the second kind of checklist is the school-friendly safe back to school checklist. And we will talk you through what these checklists are all about. The next part is the technical annexes. There are actually 8 annexes now. What we have there is just 7, but there are 8, and those are the titles of those annexes. The 8th additional annex is something that we will talk more about later. It's the annex on additional considerations for early learning programs. So the annexes are detailed guidance and resources for specific activities. So just take note that all actions not all actions will be appropriate in all contexts, and we will have to contextualize it based on local practices and align them with government standards. Next slide, please. Now, who will use this guide? Who is it for? It's for you, it's for me, it's for all of us practitioners here, because this is meant to be used by program teams, coordination teams, advocacy teams, and also especially working with partners. If you sit in the child protection area of responsibility, the working groups, the local education groups, of course, the clusters, this is something that you can use to share and work on a coordinated response for school reopening strategies. Next, please. Next. Some key principles, and these are the key principles for a safe back to school. The first is having an integrated approach. COVID-19 has a multifaceted impact on children's rights, such as on education, protection, health and nutrition. And as schools prepare for reopening, there is a need for a coordinated and integrated approach. The next principle is on participation of children and youth. Children have a right to be heard in processes that impact them. And child participation, should be inclusive and accessible for all children. Young people can play a key role in community mobilization and dissemination of accurate information. The third principle is gender inclusion and accessibility. Children may face barriers or have different needs upon returning to school because of their age, their gender, because of their socioeconomic status. And all efforts during school reopening must be inclusive and accessible for all children. This is a unique opportunity to bring all the children to school, both those who are coming back and also those who were already previously out of school. And this resource includes practical ways to be gender transformative in the approach and interventions. A whole school community approach means that we should engage the whole school community. That includes children, caregivers, teachers, school administration, community and local government in an inclusive and accessible way at all stages in the school reopening process. The next is building on existing structures. These structures can be the children's clubs, the student councils, youth-led groups, or family network, and school communities should capitalize on their existing capacities when the school reopens. And finally, build back resilient. The school reopening process provides an opportunity to strengthen existing systems, making them more accessible, inclusive, participatory, and protective. And by applying the lessons learned from COVID-19, governments and whole school communities can better prepare themselves and reduce risks of future crises that can be related to health, natural and everyday hazards, violence, and conflict. Next, please. Next, this part is the integrated checklist. Next slide. So we can see here that this portion is actually the 6 pages of checklist and provides key actions for health and nutrition, WASH, M&E, education and child protection sectors. And they are divided into before and after schools reopen to ensure sectoral integration in the process. And it also includes actions to prepare for a second wave or another type of emergency that also may cause school closures in the future. Next, please. This is just to show you an example of the checklist. This is what the checklist in the resource looks like. You can see that the checklist has short, clear actions, and there are also links to certain resources, either in different languages as well. And these are actually the annexes. Next, please. Okay. So this is the checklist for the meal. Before schools reopen, certain activities need to be done to ensure that the schools will be safe for children to return to. And this includes assessing readiness of schools, including the teachers and the learners, as well as the facilities to ensure that physical distancing can be observed as per national guidelines, if this is available. And after the schools have reopened, we should conduct needs and gender assessment using participatory methods to find out if children and young people were able to continue learning even while the schools were closed, and to plan for any support they need upon their return to school. As for the accountability and feedback mechanism, this will collect feedback from the learners and the teachers to get information and their experience when the schools were closed, and this can also help planning for future school disruption. And the next slide is on health, nutrition, and WASH. I'll hand it over to my colleague, Anton, who is the Regional WASH Advisor. Over to Anton.
Thank you, Rachel. Hi, everyone. So, as Rachel mentioned, the checklist is strengthened on a 2.1 is the before school reopen and the after school reopen. For the before school reopen, we using the checklist is for us, all the practitioners, the all key stakeholders, to ensuring that all schools should be clean and disinfected, including the features in school that reserved for people with the disabilities such as handrail and ramps, the doorknobs. And however, the most important also, if school have been used as a treatment or isolation center or other types of temporary in a rural area as a quarantine or a health facility, it should be more thorough disinfection process as advised by a local health official. As the same with previous presentation that the checklist also including the link to various WAS resource and the cleaning instruction to serve as a guide to user of this guide. To engage with the community in cleaning and maintenance of school reopening. Everyone who involved, we need to undergo our training on cleaning. They know how to do, follow up the SOP, disinfection process, deliver in the language that everyone can easily understand. Thus, including also frequency, a safety protocol for cleaning and disinfection should be established. Before school reopen, it should be ensured that the school have adequate water supply, consistent water supply, toilet, and hand washing station where the soaps always available. There's also including the menstrual hygiene management that for adolescent girls, or the and also including the teachers and learner in all staff in school are trained on correct school hygiene practice and disinfection. The age-appropriate, inclusive, risk communication and community engagement message should be prepared. There's a guidance in the checklist on how to make sure that the messages are accessible to all, including very young children and those with disabilities. If the meals and snacks are provided in school, using the checklist, the safe food preparation and service protocols should be in place. Essential school health services, a referral protocol should be in place. This including stocking school with first aid kit, PPE, training of school personnel, and protocol related to COVID-19 prevention and control. For after school reopen, the cleaning and disinfection of facility and surrounding areas should be done on regular basis, as well as maintaining all WAS facility and supply. The learners should be educated on good hygiene, health and nutrition, and menstrual hygiene, including maintaining school social distancing. Also, whenever it's possible to improve on the infrastructure, including the open windows to allow the fresh air, the air circulation if feasible. School canteen facility and utilities should be cleaned and disinfected regularly. The food vendors and canteen staff should regularly wash their hands and adhere to health protocol in preparing and serving the meals. They should also be preparing for any future school closure in case of virus outbreak. The step including sanitizing the school before it's closed, proportioning water supplies. So something take away from this. Sometimes it's not easy to follow the standard, especially where they are in rural context, where the school are very limited facility. Some village, imagine a school located in a very rural area like a village, they're difficult to get access to water. How they see this, the checklist, this send back to school guidance. So again, what Rachel mentioned that this is something that we using is not a cast in stone. That has to be something more practical. So that's a key message I want to make as a WAS specialist, that be more practical and then not using this guidance, has to be adapting into the local context. Over to you, Rachel. Thank you.
Thank you, Anton. I think we move to the next slide, please. Yes, because this is the checklist for education. Before I discuss further, this guide, just as a reminder, this guide may be used in all learning spaces for formal classrooms, non-formal, ACCD centers, and even temporary learning centers or spaces, such as in humanitarian responses. There is a link for technical annex to adapt this guide to camp settings. And also for the early learning programs, another colleague will be discussing that after 2 more slides. Okay, so before schools reopen, we prepare for physical distancing in and around and on the way to school. We can think about staggered schedules for different groups of children, or perhaps using different parts of the school. Some schools can try to reduce the class sizes, especially if they tend to be too too many per class, or even using multiple class shifts, and using shortened class time, or sometimes think about amending seating arrangements, or even putting up temporary learning spaces within the school grounds. Also, we can substitute certain activities that entail physical contact with other activities that allow for safe physical distancing. Now, in prioritizing the most vulnerable, there are several technical annexes that are relevant to this section. There is the technical annex for participatory, inclusive back-to-school campaigns, and also a technical annex to discuss the absence management system. And those are all part of this resource. And when the schools reopen, we prioritize psychosocial support, or PSS, as well as social and emotional learning, or SEL, activities in the first few days when schools reopen. There is a specific annex on MHPSS for children, and this includes links to activities that are included in the guide. Also, support for teachers when schools reopen is critical. There is a technical annex 3, which includes ideas for supporting teachers' well-being and links to resources on COVID-19. Finally, the schools should also be planning for any future school closure, and there are several resources within this resource that are linked to prepare for this event. Next, please. Okay, this is the other checklist that I mentioned at the beginning. This is a 2-page synthesis for head teachers or school management to use. It has 3 parts. The first part is a mini checklist, and it pulls out the key actions from each sector from the main checklist for schools to complete before schools reopen. The second part are questions to use with members of a whole school community to help prepare for safe return to school. And the third part identifies steps to take to support teachers specifically for the return to school. So that's the second checklist. Next, please. The next checklist is on child protection, mental health, psychosocial support. I'll call on colleague David, the Regional CP Advisor, Save the Children.
Okay, thank you, Rochelle, and good afternoon, everyone. Talk a little bit about the child protection and the mental health and psychosocial support components of the Safe Back to School checklist. I think, as we've already heard from some of the previous speakers, we understand and we know that the impact of COVID-19 on the protection of children has been quite significant, both in terms of increased risk of violence and abuse, and as well as issues with psychosocial well-being, in particular due to prolonged confinement or isolation within homes, but also in speaking about child protection more specifically, I think the kind of inaccessibility or lack of access or difficulties or challenges with access to local child protection systems and mechanisms, including those, of course, in schools, which may monitor and report and respond to protection concerns that children have. So the actions included in the guide are divided into a kind of before schools reopen and after schools reopen. Just a few of the things with regards to before schools reopen, adapting school-based reporting and referral mechanisms could be, and this depends upon the existing school-based reporting and referral mechanisms as they were prior to COVID. So adapting may actually mean kind of revitalizing a bit more, or even moving towards establishing kind of more robust school-based reporting and referral mechanisms. Where there are existing mechanisms, child protection mechanisms and services, we want to ensure the continuity of those before schools reopen, ideally. Information and advice to children and school staff if they have concerns about a child or potentially another child as well. And facilitating any sort of coordination, in particular between education and child protection actors, as best we can. And I think a lot of that is probably already happening, as you've seen through going through some of the other checklists. They all seem to have very intersectoral components to them. After schools reopen, we really want to ensure that the availability of psychosocial support, both what might be available in the classroom or schools, potentially something like what Rochelle just referred to with socio-emotional learning, or other PSS types of support mechanisms, as well as we want to be ensured that the referral mechanisms are in place. And in addition to the referral mechanisms, as I mentioned, that the school-based reporting is also functioning. And again, if that means revitalizing them after a long period of school closures, that sort of needs to be one of the first steps. Ideally, that's taken before schools reopen. And in particular, when schools do reopen, we want to be able to ensure that we're able to identify the children that are in need of support and that might need referral services as well. And we also want to ensure that we're delivering age appropriate. This is not something new really, but this is kind of always the case within education, but ensuring that both our protection and MHPSS initiatives are age appropriate, gender and inclusive sensitive, and that we include that messaging that is aimed at preventing violence, abuse, bullying, even increasing issues with stigma, for example, that are coming up. Okay, the next slide, I believe. Thank you. So there are quite a few technical annexures. I believe Rochelle just mentioned Annexure 3, which looks at really enabling teachers in the transition back to school and how that speaks to the protection and MHPSS. There's some specific guidance on how teachers can be involved in identifying and reporting protection concerns. And there's also some links in the third annexure, which focuses on things like psychological first aid and violence prevention and response. There's also a technical annex number 5, which is participatory education and protection continuity planning. So this kind of gets into what I was referring to before, where we might need to really look at what are the reporting and referral mechanisms that are in place. How much does that need to be revitalized? And also kind of looking again at what the key protection risks are, you know, in a pre and post-COVID context, so that we can use that information to reassess school plans. The slide that's up here is Technical Annex 4, is with regards to MHPSS for children as schools reopen. I think that in this particular slide, it's important that it focuses both on, you know, one, what parents and excuse me, parents and caregivers can do to help prepare the return to school, and secondly, what children and young people themselves can do. And so for the parents and caregivers, there's a suggestion, and there's actually links within the technical annex that suggest a lot of MHPSS related activities at home, and that some of these may even continue even after children return to school to make sure that we ensure this kind of smooth transition. And there are also links within this annexure to for some simple activities that can be implemented with children. And secondly, you know, what children and young people can do, it's which suggests that very important, and I think that this is something that's been ongoing throughout the COVID response, you know, making sure that we have child-friendly information and communication channels, and that those are inclusive. Lastly, I think it's interesting that, you know, I work for Save the Children, and I've been reviewing at least with Save the Children and our COVID response strategies. We've seen that a lot of our country response strategies have aspects of MHPSS support built into them, and in particular, really strong links with socio-emotional learning, which Rochelle referred to earlier. But I still feel like that maybe there's some space that could benefit from a little stronger coordination with child protection colleagues within the organization and with schools themselves making links to local child protection systems as they are, so that this could be a little bit more integrated in its components. I'll leave it at that, and I believe I'm handing over to Diane from SCI Rwanda, who's going to take us a little bit through some of the ECCD components. Thank you.
Thank you so much. Good morning, good afternoon. So as Rachel mentioned, this is the new technical annex number 8 for e-learning programs that was developed recently. And it was added because also young children below 6 should be considered when you're opening e-learning programs, either informal or formal, such as preschools, daycare, and community ECD centers. So this annex was developed to focus on 3 challenges specific to young children. The first one is prevention of COVID-19 transmission, because young children may be less able to cover sneezes, and they need to be held and comforted. They also have a habit of touching things and putting their fingers and objects in their mouth. So that's why there is a need of special consideration for this group. The second one is having small group learning with sufficient teachers. The concern here is how to create spaces, learning spaces with sufficient teachers to offer safe, playful, and engaging activities, but also by minimizing the risk of contamination. This could be a challenge in case more teachers will be needed, and there may be fewer teachers available if some existing pre-primary teachers, like in some countries, pre-primary teachers, they are planned to be sent to support primary grade. So the last one is the last challenge is about home learning, because we know that home learning is one of the most significant contributors to improving child well-being and learning outcomes. But parents and caregivers, they need support. They need to be equipped to improve children outcomes at home. So having these 3 challenges, we developed a checklist that focuses on ECCD managers or administrators, pre-primary teachers, or caregivers, and also parents. So I'm not going to present all of them, but I will highlight some. For example, for the managers or administrators, the first one is they can put in place measures to reduce transmission, such as preparing the opening plan with the parents or the community by clarifying responsibilities and practice. Also installing hand washing stations. They should be accessible to young children, including children with disability, and also plan or discuss about screening children when you're opening centers. Another aspect is to increase outdoor learning time, because the risk of infection is lower outside. We know that learning activities such as playing can be done outside, but even doing those activities outside, managers, they should make sure that they have standard safety measures that they have put them in place. And this is something they should always think about in order to minimize the contamination. managers should also ensure that teachers are trained on how to support on how to support children, young children when you're opening learning centers. And teachers also should be trained on how they can support children who feel like who have stress. And then teachers also should be trained on how to make sure that children don't feel pressured to catch up in literacy and numeracy as soon the e-learning programs reopens. Next slide, please. So for the e-learning staff, like teachers, for example, they can organize materials into kits that can be used with small groups. And again, those materials should be cleaned or washed at the end of the session for the next users. Teachers can make additional learning materials and big books. So they can make those materials by using local available materials in the community, and these materials can be thrown at the end of the session. So this is like for increasing the number of materials, but also minimizing the risk of contamination. Teachers can also use small activities like they can use stories, songs, and activities to promote good washing. They can like develop those kind of songs and activities that promote hand washing and respiratory hygiene to promote children's well-being and social emotional learning. And this can be done by establishing a routine of these small activities, like when they come in the morning or when they go back at home. The last one about teachers, they should be supported to know how they can recognize young children. As my colleague was saying, young children may be experienced psychosocial distress, and teachers can notice those changes like changes in behaviors, for example, too much crying, trouble sleeping, and these children should be referred to specialized services. In terms of parents, they have to ensure that their children do not bring items such as dolls or toys from home to preschool or to community ECD centers in order to minimize the risk. And again, parents should also continue engaging with their children through learning activities at home to support them in learning, but also in their social well-being. So we think this annex and the guide will be useful when you're opening learning programs. Thank you so much, and we hand over to the next presenter.
Thank you very much, all the presenters. I would want to hand over to Amy now for moderating the brief Q&A. Over to you, Amy. Thanks.
Thank you very much. We just want to be respectful of time because we have many good presentations beyond, but I've noticed the chat box and it looks like ongoing questions that have been asked have also been answered, which is good. So I'll open it up to the floor if anyone wants to raise their hand, and feel free to speak up or continue using the chat box. All right, I see Rangsun with a question. Maybe you can unmute yourself, please.
Yes, thank you for the presentation. I think all those sharing are quite useful, but I I saw that there was one time that at regional office also shared the resource regarding to children with disability. If you could a bit more direct to that kind of resource, it would be helpful, because now we are working with the Bureau of Special Education Administration to localize that materials. So we want to know that if we have any other tools we can incorporate in the discussion. Thank you.
Hello, hi, this is Rochelle. Just to respond to that very quickly, the whole resource had in mind children with disabilities and children from the most marginalized communities as well. So there are some specific activities for children with disabilities and for girls that are part of the resource. So I think for like very specific to children with disabilities, this there is no if I can remember correctly, a resource that is annexed there, but if my colleague Mary is here, maybe she can update me on that. But so far, there are specific activities that mention children with disabilities and girls, and even children from ethnic minorities or other languages that are represented in the school. And those are mentioned in the resource. Thank you. I can see that our colleague from UNICEF, Dom, has also shared a resource in the chat box called the Inclusive Return to School that you may want to refer to as well.
Thank you very much. I don't see any other raised hands. Anyone feel free to add on?
I think that right now we can respond to those queries in the chat box as we go along, and we can continue with the country presentations from here on.
Perfect.
Thank you, Amy.
Thank you.
So now we go to part 3 on the country examples. I'm Thea Soriano, and I work with the Asia South Pacific Association for Basic and Adult Education, and I'm happy to facilitate this session. In this session, we will hear about the work that ministries of education are doing, and also as well as the efforts of practitioners in preparing for the safe opening or reopening of the schools. We will also hear about the reflections of the presenters on the usefulness of the Safe Back to School guide that we are launching today. So we have 3 presentations, and this will be for 15 minutes. So 5 minutes per presentation, and then we will move on to a 10-minute Q&A. So we are very happy to have 3 presenters today. The first one will be from Thailand. She is Anna Lailo, the Education in Emergencies Advisor of Save the Children International. And then from Thailand, we will go to the Philippines, and we have Professor Flora Arellano. She is the president of the Civil Society Network for Education Reforms, or ENET Philippines. And then from there, we move to Laos, and we will hear the experiences from Laos. We have Liotes Helin. She is the Chief of Education of UNICEF Lao PDR. So without further ado, I would like to call Miss Anna Lailo to start the discussions. Anna?
Yes, thank you very much. Can you hear me well?
Yes, we can hear you, Anna.
Okay, thank you very much. Good afternoon and good morning to everybody, and thank you for having me in this webinar. So I would just give you the brief outline of my presentation. First is the context of the Save the Children Thailand education programming, and then I will move on to discuss the effects of COVID-19 on the education programs. And then I'll move on how the Safe Back to School Practitioner's Guide helped us to prepare the schools for reopening. And the fourth discussion will be on how the contextualized safe back to school guide is being used by education authorities in Thailand, particularly in the refugee camps. So I joined Save the Children Thailand in April, just when they are starting to mount the COVID-19 education response. So it was a very exciting and challenging time to join the country office. Save the Children Thailand is supporting programming both for migrant children and for refugee children in northern Thailand. And this presentation will focus on the program for refugee children in northern Thailand. So the context is that there are around 16,000 primary and secondary learners in their 9 refugee camps along the Thailand-Myanmar border. So it spans 3 provinces, and these are the Karen minority group. And there is a Karen Refugee Education Entity, which is the counterpart of the Ministry Education for the refugee camps. And together with Save the Children Thailand, they lead the education sector, and they are the key actors in basic education in the refugee camps. Also, there is a coordinating committee for the provision of basic services for the refugees in northern Thailand. And this is led by UNHCR, and there is a specific education pillar subcommittee. So this serves as a coordination platform for the provision of basic education. And there is limited policy and funding support to education in the camps from Thai government. And overall, the support that the refugee children in the 9 refugee camps is getting is very limited. And how has the COVID-19 affected the education of refugee children? There are around 45 primary and secondary schools in the 9 refugee camps, and they have been closed since March 18. And they were supposed to open on the 1st of July. So that's like 3 weeks ago. The second effect is loss of learning, of course. And this is true, I guess, for every learner wherever in the world, because learners in the refugee camps have lost at least 10 weeks in the school's calendar. And distance learning, and this is paper-based distance learning, was provided for just 6 weeks because of very limited capacity, both by the education authorities and the NGOs which are supporting the education sector. And this is aside from the Another one is psychological stress for children, because children are confined for a very long time at home with not much activities. And for those of you who have worked in refugee camps, you know how the shelters in refugee camps would look like. And usually families would be around 5 or 6 or 7. And then the children do not have their regular routines of going to school, seeing their friends, and playing with them every day. And parents are not really prepared for this, for having their children around every day, 24 by 7. And not all parents are ready or able to support their children in terms of psychosocial needs. Another effect of the pandemic is that some teachers and learners were unable to return to the camps for schools reopening. So I mentioned earlier the schools were supposed to reopen on the 1st of July, but there's a big number of teachers and learners who are stranded along the border because when the schools closed on March 18, it was close to the summer break. And so there were already teachers and children who went to Myanmar to visit their families, and then the borders was closed, and they are not able to come back until the schools are already being announced to be reopened. And of course, exposure to other risks like there are a lot of documented risks of prolonged school closure, like child labor and gender-based violence and child abuse. And also the risk of a lot of children may not be able to go back to school, especially adolescent learners, those who are in the secondary, because one is that they have probably gone back to Myanmar, or second is that they are probably engaged into some livelihood activities already. And then next slide, please. So how has the Safe Back to School Practitioners Guide helped us in preparing the school reopening? So this guide has actually served as a guide for first cross-sectoral integration, because since the guidance enumerates the different sectors that need to be part of the safe reopening of schools, it enabled us to do some cross-sectoral coordination with health, WASH, protection, and risk communication and community engagement. So in the national level coordinating platform, we had cross-sectoral meetings, which were solely dedicated to discuss the reopening of schools and how we can complement the services that each organization is providing. And also we discussed the issues, the major issues that could hinder the reopening of the schools and how they could help with those issues. And also it also served as a guide for advocacy, because it guided us on what advocacy pieces we needed to pitch to different stakeholders, like we advocated for the Ministry of Interior to allow for schools reopening once the guidelines are in place. Because also the camp authority, they are quite adamant to reopen the schools because it may be very risky. So there were negotiations that we will come up with the guidelines, and then if it's okay with you, then that will serve as the criteria for the schools to be allowed to reopen. Also, we advocated for camp authorities not to use the classrooms as isolation facilities for suspected COVID cases, as the schools were reopening soon, so the schools have to be kept safe for the learners. And lastly, this Safe Back to School Practitioners Guide helped us significantly in developing the contextualized guidelines for safe schools reopening in the 9 refugee camps in northern Thailand. So this guidelines was multi-stakeholder, it was in consultation with different education stakeholder in the camps. And it was drafted with parents, with teachers, with NGO partners, and it was eventually adopted by the education authority in the refugee camps, which is the current refugee education entity. And so how is the KRCE or the education authority using these contextualized guidelines? First, it served as the standard in determining school readiness to open. Since the guidelines are in place and it's been adopted and approved by the authority, so it is the standard for them to allow the schools to reopen. The schools were originally scheduled to reopen on the 1st of July, but a lot of schools were not ready on the 1st of July. So the original plan of having all the schools reopen at the same time was revised. And what happened was schools gradually reopened based on their readiness. Also, it is used by education authorities to monitor school compliance to the guidelines. Whether you have these guidelines, are the schools complying with these guidelines, and what the issues are for non-compliance. Also, it's used by teachers and school heads to identify activities that can be allowed or disallowed in schools, like what activities of children. For example, children are allowed to play, but not games which will involve close contact with other children. it also determined how classes will be conducted, like shifting classes, or some days the children are in school, but other days they have to be studying at home. It also defined the routine activities that children have to learn and routinely practice in the schools, like hand washing, safe, proper coughing etiquette, or maintaining distance from each other. And lastly, it is being used to solicit support from parents to support safe return to schools, because parents are stakeholders and the roles and responsibilities of the different stakeholders are clearly stated in the contextualized guidelines. So education authorities are using this to solicit the support from the different stakeholders, especially the parents of the learners. I think that's it for Thailand. Thank you.
Thank you so much, Anna. And we're very happy to know that in Thailand, there is really cross-sectoral coordination. And this is not only happening at the community learning center or at local level, but also at the national level where policies are being made. Thank you so much, Anna, for that presentation. And now we move to the Philippines, and I would like to call Professor Flora Arellano. Please, Flora, you may take the floor.
Okay. Good life for all. Magandang buhay para sa lahat. Good morning, good afternoon. This is Flora Arellano from INET Philippines. Now, my presentation has something to do with the situation of our learners in the Philippines, and then the initiatives taken by the Department of Education, and third, the CSO's initiatives. Next slide, please. Next slide. This coming August 24, the distance learning school opens. Now, there are about 28 million learners who have been affected in the public and private schools closure. About 3.8 million Filipinos aged 6 to 24 years old were OSCY. 12.8 million Filipinos 59 years old have not completed their basic education. 2.4 only out of 5 million indigenous children were enrolled in kinder to grade 11. 3.3 million children with disabilities were excluded due to inaccessible schools and disability-insensitive learning environment. Even prior to the COVID, they're already neglected and not given support. As of July 3, enrollment in public, private, state colleges and universities, as well as in local universities and colleges, reached to 17,823,077. 148 are learners with disabilities. 217,905 are OSY, enrolled in ALS, Alternative Learning System. Now, the DepEd Commons, this is the online platform of the Department of Education. As of June 9, there were only 8 million subscribers out of 28 million learners. Now, there are about 1 million teachers and school personnel in the Department of Education, the highest workforce in the government bureaucracy. Next slide, please. Next slide. Using the platform of Education Forum, the local education group, the LEG, in the Philippines, DepEd held participatory learning continuity plan designing, involving civil society organizations like us, private companies, academia, and sectoral organizations. And we discussed and divided into 5 groups: the data analytics, the modalities, capacity building of teachers and school leaders, how to operationalize the plan, bridging short, medium, long-term plan for sulong edukalidad. And we came up with adjusted K-12 curriculum containing most essential learning competencies out of the former curriculum competencies set by the K-12 of the Department of Education. So it was reduced. And then contextualized, localized, blended learning delivery modalities either online, offline, synchronous, asynchronous, mix of TV and radio instruction. And then mapping of learning resources in each learning delivery mode was also done by the Department of Education. And last June 15, the training of teachers started through webinars. And then this coming first week of August, training of parents, where teachers will be helping in giving the training. Next slide, please. Next slide. On August 24, this will be the opening of classes, where there will be online classes in the general sense. So in kindergarten, maximum of 1 hour daily, maximum of 1.5 hours daily. Grade 6 to 8, maximum of 2 hours daily. Grade 9 to 12, maximum of 4 hours daily, 2 hours in the morning and 2 hours in the afternoon. The Department of Education also conducted a webinar on preparing healthy and affordable meals, webinar on mental health and psychosocial support services. Now, this coming next year, January 2021, depending on the epidemiology analysis, there will be limited face-to-face classes in low cases and COVID-free areas with 20 to 30 learners in a class, depending on the size of the classroom, with limited time in the school, morning or afternoon classes, about 3 times a week. Next slide. Next slide, please. The Department of Education also intensifies the wash in schools, the WINS, no? For hand washing, provision of safe and adequate water supply, provision of toilet, hand washing, and drainage facilities, environmental sanitation and solid waste management, food sanitation, menstrual hygiene management, deworming, thermal scanner, hygiene and sanitation education, all in the back to school guideline. Okay, next slide, please. Now, the next slide has something to do with INET Philippines initiatives. We are continuing as resource persons in our parliament, the House of Representatives and Senate hearings on basic education amid COVID-19. And we push for the safe back to school, which include the feeding program, but this time the budget for the feeding given for the Bayanihan app, and then the WASH, the hygiene kits, the psychosocial sessions with teachers, parents, caregivers, and learners. We also launched webinar series on positive discipline and cyber safety on children, because the situation of children right now, because they stay at home most of the time and has limited movement, because of the quarantine, the family stress increases, especially on learners. Especially the girls, they face some issues like spending more time in online and its consequent vulnerability to abuse, sexual exploitation, and cyberbullying. These are the common problems right now. And then we have also launched webinar series on positive discipline, and we also implement positive discipline in everyday teaching, positive discipline in everyday parenting, and conduct of child's rights monitoring in Luzon, Visayas, and Mindanao, in partnership with the Save the Children Philippines and INET member organizations. Now, with regards to the coordination with other civil society organizations, we work together in order to protect and ensure the health and safety of our learners, as well as our teachers, the frontliners in school. And are continuing as our initiatives in our dealings with the House of Representatives and Senate, recommendations on increasing the budget for education, especially addressing the impact of COVID-19 in schools and especially for our learners. And we also do some localization of budget initiatives at the local government units, where we tap the special education fund to prioritize the utilization of this fund for the learners in implementing the learning continuity plan in the last mile schools. The last mile schools are the sites of learners in remote, geographically isolated areas. And we would like to thank the organizers of this forum, the education, education global cluster and the child protection global cluster. We would like to extend our congratulations and thanks in coming up with this safe back to school practitioner's guide. Very informative and very detailed practical tips, gender responsive, equity based, and ensuring child participation and protection. We suggest that probably more guidelines on how to protect children from physical and humiliating punishment in home-based learning, as well as in online bullying, abuse, and exploitation in the cyber world. Since in the guide, the school has been defined as a formal and non-formal learning spaces for all ages and various levels, it would be helpful in the guidelines to include the responsibilities of parents and or caregivers in safe learning continuity of the children. Thank you very much.
Thank you very much, Flora. And your presentation broadened our framework for safe return to school. And thank you for giving us the information about ENET's work around child protection and positive discipline. So thank you for that. I would like to encourage colleagues to please write in the chat box because we have less time now. So we might not have a Q&A afterwards. So if you have questions to the presenters and comments, please write them in the chat box. So now we go to Lao PDR. I would like to call Leotes, please start your presentation. Thank you.
Hi, thanks, Thea. Good morning, good afternoon, colleagues. Greetings from Laos. My presentation is really focused on the back to school campaign that UNICEF Lao PDR supported the Ministry of Education with. First of all, I'm sorry the slides, there's something wrong with the graphics, but basically I just wanted to give a quick background of the country context. Just like in many other countries, all educational institutions in Laos were closed from 19 March, affecting over 1.5 million learners. Basically, Laos has been lucky that we didn't have so many cases, but this closure still really translated to 8 weeks of school time lost and really highlighted the challenges of providing access to remote learning options. At the same time, while we were thinking through with the Ministry of Education how we can reopen schools and make sure it's safe given the pandemic, it also really showed the inequalities and the challenges in education. 25% of schools have no water, there's 50% have no electricity, there's limited internet connection, and there's a textbook shortage. So this really showed the key challenges in terms of making schools safe and as well as providing continuity to learning. At the same time, looking at the broader context, Laos shares a very porous border with China, Vietnam, Thailand, and Cambodia. So there's still that risk of importing the virus. And then there's, again, the possible school closures. We have a weak health system, high stunting rates, high incidence of violence against children. And this makes, again, the impact of COVID quite challenging. And broadly, it's really looking at the socio-economic impact COVID, not just in the education sector, but really in the whole country. And again, what the impact it will have on budget cuts in education. Next slide, please. So what did UNICEF do to support the Ministry of Education? Right from the start, I think in late February, we already started discussing with Ministry to develop a COVID-19 education response plan. And this was done as well in consultation with the different development partners. At the same time, we really used the education cluster mechanism as an information sharing and coordination sharing platform. The education cluster in Laos is chaired by the Ministry of Education, but co-led by Save the Children and UNICEF. And while the cluster was not activated, I think it still served as a good mechanism to coordinate with the different partners. At the same time, throughout the whole, since February, throughout the whole pandemic, risk communication was really a key intervention. And the coordination with the Ministry of Education and Ministry of Education along with the other partners. All these interventions were really designed to help the government reopen schools better. At the same time, reduce inequalities in terms of learning options, particularly remote learning options, and of course, improve the resilience of the sector. Next slide, please. When schools were closed, one of the key areas that we also prioritized is really to ensure the continuity of learning. We produced videos shared online and on national TV. We supported the ministry, set up an education TV channel. At the same time, there were activities for children to do at home. We also integrated, made sure there were parenting tips and psychosocial support awareness and messages. Read aloud campaigns, but really the key here was, and we're still trying to do it now, is to institutionalize remote learning options and the realization that there is no one approach that could reach all the different segments of the population. So it really has to be a blended approach. Next slide, please. On the back to school campaign, as soon as the ministry, we started talking about reopening of schools, we then, once there was some indication that the government was willing to reopen schools, we launched a back to school survey targeting parents, teachers, and students. And this really helped gauge and get a sense of the concerns of the different of parents, teachers, and students. And this helped us tailor messages for the back to school campaign. A key intervention as well was supporting the ministry develop protocols for the reopening of schools. And as I mentioned, the messages, risk communication messages were really done with the Ministry of Health as well. Social media messages were co-branded, and one of the key features of the back to school campaign was really the partnerships, working with the different multilateral, bilateral organizations, but also INGOs in disseminating the key messages. We had public PSAs, videos for schools, teachers, and parents, and also in different languages with sign language included to make sure that it was also disseminated widely via national TV, radio, and online. And as well as a checklist for schools, parents, and students to help them prepare for the reopening of schools. The reopening of schools was done in a staggered way from May 18, and one of the first things that we really did to support the ministry was to develop the Safe School Operation Guidelines based on the global guidelines, which was released by WHO, UNICEF, and ICRC. At the same time, we also used the framework for reopening of schools, shared it with the ministry, and used it as a basis. The other one, as I mentioned, is really the back to school social media campaign, and this was done with different partners. Another key point, and I think this was mentioned earlier, was that some of the schools were used as quarantine centers for returning migrants. And I think one of the key elements for back to school was really to show to the public that schools used as quarantine centers were disinfected, because this was one of the key concerns that came out as well in the surveys. Next slide, please. Just to share really a key highlight, more here, a quote from one of the students and the teachers when the schools reopened, how relieved they were that it could reopen and they could proceed with the exams. And as well as the teachers were very much happy that schools could reopen. But again, there is still that concern that there's a second wave and a third wave, and how can we keep schools really safe? Another key highlight of our back to school campaign is the social media reach that we had. Basically, we had 8.9 million impressions and 4.6 million reach. And this is just for UNICEF platforms. But of course, we work with different partners, so the reach was much bigger. Next slide, please. So this is the last point that I wanted to highlight is in terms of our next steps and key lessons. As mentioned earlier, Laos has been lucky. We've had very few cases, and we are now looking at the start of the new school year in September. Hopefully it could go ahead. But what we are trying to do is really look at good practices and lessons from the Safely Back to School campaign, which we launched earlier for the school reopening, and how we could adapt it to the opening now for the new school year, but also learning from what other countries are doing. What we found as well is that partnerships and coordination is really critical to reach the whole country, and also the coordination with the different players in education. Opening up better also provides an opportunity to root innovative pedagogical approaches and learning pathways for learners. And at the same time, while, as I mentioned, we've had a few number of cases, I think that it's really crucial to continue the risk communication messages around safe schools operations to ensure that there's vigilance. And the last point that I wanted to flag as really a key lesson for us, of course, as we all know, COVID-19 is unlike any other emergencies we've had to deal with. And it really requires greater coordination, including across and within key social sectors. I think here in particular, the coordination with the health ministry, health sector, and education was really important, as well as integrating the child protection aspects. These are the key, I think, points from the Lao experience. Over to you, Thea. Thank you.
Thank you, Leotis. And thank you to all the three presentations. Excellent and inspiring stories of how countries are moving towards safe opening of schools as well as community learning centers. Thank you to all participants who have been very active sharing their comments and questions in the chat box. Unfortunately, we don't have time for Q&A. So now I give you back to Rachel to close this forum. Rachel?
Hi, everyone. Thank you for staying on. And as Thea has mentioned, we'll just send the resources and this presentation to you all. If you have signed the registration form, we'll know how to get in touch with you. Thank you and have a good day, everyone.
Thank you.
Goodbye.